Welcome to The Explainer. We're diving into a huge topic today, accountability in healthcare.
When a mistake happens, our first instinct is to ask, whose fault is this?
But what if we asked a different question? How can we actually learn from what happened?
It all starts with something called organizational transparency. Basically, being completely open about how things are going.
See, when you're open like that, it builds trust and creates a culture where learning from errors is okay.
But getting there isn't easy. There are two massive roadblocks. One is human, the other is a machine. The human problem is a deep-rooted culture of blame. If you're scared to report an error, nobody learns.
And you've got this disconnect, right? Managers focus on policy while doctors are focused on patients.
Now for the machine problem. Let's throw some artificial intelligence into this already tricky situation.
Doctors are asking, if an AI gives bad advice, is it my fault or the developers?
We're talking about so-called black box algorithms. How can you trust a recommendation you don't fully understand? And get this, a recent study shows most clinicians feel responsible, but they want developers to share that burden.
So how do we actually fix this? The solution has to come from two directions, top-down and bottom-up.
Let's start top-down. Johns Hopkins has a great model. They treat patient safety just like they treat their finances. Their framework creates super clear lines of responsibility, from the board all the way down to the bedside.
But all the rules in the world won't matter without the bottom-up part, building a culture of safety.
This means staff have to feel safe enough to report errors, and even patients can speak up.
So you see, the real goal isn't about assigning blame. It's about creating a system that's constantly learning.
So we need to ditch the blame game, figure out AI's role, and build safety from both ends.
Which leaves us with a pretty big question. Is our healthcare system actually built to learn or just to blame?